Hey FLORA members, my name is Molly Pelletier. I'm a registered dietitian and the founder of FLORA. Today I'm going to talk about how to talk to your doctor with digestive issues or about digestive issues. And I firsthand know how hard it can be to have a conversation with your doctor about digestive issues or going to GI doctors and, trying to figure out what is wrong with no avail or, getting blanket diagnosis like IBS or being advised to take a medication that maybe you don't feel comfortable taking. So we're going to go over all of that and really how to have productive conversations with your doctor in this video. First of all, it's not okay for your doctor to tell you that your symptoms are all in your head. It's not okay for your doctor to dismiss your symptoms. It's not okay for your doctor to, not even consider the root cause and just throw a medication like a PPI at your symptoms without even knowing if you have acid reflux or knowing if high stomach acid is a problem. PPIs are a big topic because they are being given out like candy, and sometimes they are very, very helpful. Sometimes we do need PPIs in the short term or to prevent irritation, because we don't want irritation in our esophagus, but they aren't really great for long-term use. And in cases where acid reflux is caused by low stomach acid, PPIs cannot be helpful. So, using the GI doctor to rule out other conditions is really helpful. So, asking for H. pylori testing, a type of bacteria that can cause ulcers and acid reflux, maybe asking for an endoscopy to see what's going on, maybe to see if you have a hernia or to see if you have a lower esophageal sphincter issue. Using the GI doctor to, rule things out for your peace of mind and just make sure that nothing more serious is happening is the best way to use your time there. Advocating for yourself for that endoscopy if you have the resources. Oftentimes, if your acid reflux isn't very severe or if it hasn't been going on for too long, you may not see anything in the endoscopy. My endoscopy only showed a little bit of irritation, even though I was feeling really uncomfortable. Sometimes I also hear from my clients that their endoscopy didn't show anything. And so it's not uncommon to have a negative endoscopy for, any sort of issue. And that's a good thing. That's great. If it comes back without, celiac, without any major issues, that's good. Because, we can still manage the acid reflux, and it's good that nothing else more serious is happening. Another test that you may want to consider asking your doctor for is called the Bravo test or the Bravo pH test. And this test is to test the pH or the acidity of the stomach. And I think it can be somewhat uncomfortable. I've never had this test personally done, but I've heard that, it can be kind of uncomfortable having the device put down your throat. But it can be really helpful if you're looking for more information about the pH of the stomach. So that could be a conversation with your doctor as well. If you're struggling with bloating or, feeling like you're really distended and bloated after meals, maybe asking for a SIBO test. The SIBO test is a small intestinal bacterial overgrowth test. That's what SIBO stands for. It's a breath test, and it can test for the presence of bacteria in the small intestine. And it can test whether these bacteria are hydrogen producing or methane producing. And that information can be helpful in terms of working with a registered dietitian for a SIBO healing protocol. And FLORA members receive a discount on my services, so you can always reach out to me if you're interested in working one-on-one. It may be helpful if you're having signs of, food intolerance and maybe skin rashes, pretty severe allergy symptoms. It may be worth doing some food allergy testing in terms of maybe working with an allergy specialist. If your GI doctor isn't really well versed in allergy testing, you can ask for a referral to an allergist. That might be helpful. I would not go the route of food intolerance testing, however. Food intolerance testing is different than allergy testing because they're looking at different types of antibodies. The food allergy testing is looking at the antibodies that are produced when a true allergy is occurring in the body. But a food intolerance test is testing a specific type of antibody that can be produced just by, the presence of the food in the body. Just because our body produces an antibody in response to a food doesn't mean that it's intolerant. And so these tests are not really evidence-based, and the American Academy of Asthma and Allergies and Immunology, as well as the Canadian Academy of Asthma and Immunology, have both put out statements suggesting that these tests are not valid indicators of food intolerance and are not to be used as an evidence-based method. So if you've had food intolerance testing, I urge you to just take it with a grain of salt. It may not be 100%, accurate, and they can bring up a lot of food fear. In terms of working with your doctor, if you're not getting the results that you'd like with your doctor, they're not ordering tests, and they are not willing to investigate what's going on with you, if you have the resources, you can get a second opinion from another doctor, another GI doctor if you have acid reflux, or if you don't know what's going on and you may want to, dig a little bit deeper. Definitely, looking into an ear, nose, and throat doctor. If you have acid reflux, that might be helpful just to rule out anything else more serious in the ear, nose, and throat. But I know it can get expensive with the tests and the doctors. So really, knowing when it's important for you to also check in with yourself and noticing, like, is this necessary? Maybe I can try a few other things before having to go see another specialist in terms of lifestyle, making sure that you're sleeping well, making sure that you're getting balanced meals, using the healing tools of FLORA. Not to say that you should push off any, medical appointment if you're experiencing intense medical symptoms. Absolutely see a doctor, but also knowing that, health anxiety can play a massive role. And I hope that this video was helpful. I hope that, your next appointment goes well. And if you have any questions, feel free to send me an email as usual, and I will answer them in our live Q&A. All right, thanks, guys.